Okay, hi guys, good evening. Shall we start the discussion? So, have you all seen the image that I had posted for with an MCQ today? So, the image is. So, how many of you all had actually gone through the image and what was the question? So, hi. I'd already told you, no? Yes. Hi Bharat, I'd already told you no quiz schedule. No, we finished our quiz cycle. So I said I'll put an Instagram MCQ image based question and then we'll discuss that. So have you taken a look at that image? Did you go through that? And also the MCQ. So what was the image? So first let's discuss the image, the clinical findings that were seen in the image. Today is going to be a short session, okay? And those of you Tamil students joining, happy Kartika Deepam. Today we have Kartika Deepam festival. Okay, so today is going to be a short session. So the clinical image that I had given to you was this. Yes. So first of all, which eye is this? According to this image that I'm showing you right now, it is a left image because you can see the caruncle medially. So this is the left eye and you can see the iris coloboma here. Yes. See, what is a coloboma? I've told you coloboma is a congenital defect or deficiency in any tissue. So here in the iris, can you see in this 5:30 to 6:30 clock hours, that 1 clock hour the iris is missing. Missing means congenitally it is deficient. So it is an iris coloboma which is described, so the pupil is described as a keyhole pupil or like a pear shape, like the fruit pear, or like a tear shape. Tear is we actually use it for something else, but yes, you can broad based tear maybe. So keyhole pupil or pear shaped pupil in iris coloboma. Okay, so one finding is iris coloboma and this is a typical coloboma. Now why am I saying it is a typical iris coloboma? See, a typical iris coloboma will be inferonasal in location like this, because this is the left eye, so this is the medial or nasal part, so this is inferonasal in location corresponding to the location of your embryonic or choroidal fissure. So iris coloboma forms because of an embryological problem. The choroidal fissure or the embryonic fissure that should have closed at the end of week 5, that is by day 35 it should have closed, it should have fused. It is not fused, that is why it results in coloboma in the exact location like that of the original embryonic or choroidal fissure. So that is why it is inferonasal in location and it's called a typical iris coloboma. Is that clear? What other finding can you see? You can see a cataractous lens behind and you can see that there is an ectopia lentis because you can see the equator of the pupil here and there is an aphakic area here. This is the phakic portion, this is the aphakic region. So you can see that there is an ectopia lentis. Yes. So the question was, what is the gene implicated? Yes. Which gene mutation causes this or these clinical findings? So typically iris coloboma is caused by PAX6 gene mutation. So that was your answer. Now PAX6 gene mutation, now coming to PAX6 gene and the eye, there are a few more things that you need to know. Now PAX6 gene, you know, is a homeobox gene. Now that is a master gene of eye embryogenesis. Okay, so it is involved in the eye development right from the start and it regulates a lot of important events. And PAX6 gene, okay, so that is one important question. So which is the master gene of eye embryogenesis? It is PAX6 gene. Okay, now this PAX6 gene, as you all know, it's located on chromosome 11. Okay, chromosome 11, the short arm of chromosome 11, 11p, band 1 band 1 subband 3. So 11p13, that is the location. Now what all can PAX6 gene mutation cause? Now one, you know, it can cause iris coloboma. Okay. Number 2, it can cause ectopia lentis. It is associated with ectopia lentis. Number 3, it is associated with foveal hypoplasia. That is very, very important. So very often in PAX6 gene mutation, when you see this iris coloboma, you'll have to look at the fundus to look for if there is a foveal hypoplasia. So foveal hypoplasia is the most common cause of reduced vision in iris coloboma patients. Okay. So number 1, iris coloboma, ectopia lens like in this case, but otherwise most commonly foveal hypoplasia. So when you see the foveal reflex will be very dull. Yes. So foveal hypoplasia, and whenever you have a foveal hypoplasia, there will be nystagmus. So these 3 findings are quite common in congenital aniridia associated with PAX6 gene mutation. Now other than that, as I said, ectopia lentis you can have, then there can be a congenital glaucoma, and there can be corneal opacities. Now why corneal opacities? See, this PAX6 gene is expressed in both the neuroectoderm and the surface ectoderm. And you know, surface ectoderm gives rise to the lens. So that is why you get this ectopia lentis, you get the congenital cataract. And also, you know, the surface ectoderm gives rise to corneal epithelium. So because of that, you get corneal opacities. Okay, corneal opacities, and sometimes even Peters anomaly. Okay, so Peters anomaly, where you have a corneal epithelium opacity, corneal opacity. So that also can be associated with because of PAX6 gene mutation. Okay. Now there is, as you all know, the Wagner syndrome. So Wagner syndrome is because of your WTN gene. So WTN gene and your PAX6 both are on 11p, just a few codons away. So you get in congenital aniridia even in your Wagner syndrome, that is Wilms tumor, aniridia, A for aniridia, genitourinary abnormalities, and mental retardation, the R Wagner syndrome. Then there is PAX6 gene mutation is associated with something called MAC syndrome. So MAC is, you get a micro-ophthalmos, a small eyeball, aniridia, and sorry, not aniridia, anophthalmos. Micro-ophthalmos, anophthalmos, and coloboma. Okay, so PAX6 gene mutation. Then what else? So you can have micro-ophthalmos. So what are all the eye findings? So primarily in PAX6 gene mutation, you'll get iris coloboma, foveal hypoplasia, and nystagmus. Now other than that, in the lens, you can get ectopia lentis and congenital cataract associated with that. Then in the cornea, corneal opacities, either just like that or maybe a Peters anomaly. Then congenital glaucoma, overall small eye micro-ophthalmos. Okay, so these are all the findings that are seen, ocular findings that are seen with PAX6 gene mutation. Okay. Eyelid coloboma, no, Bharat. Eyelid coloboma is not associated with PAX6 gene mutation. That is completely related to the surface ectoderm. It can be seen in other syndromes. Okay, like you can see it in golden hour syndrome and all, lid coloboma, but that is not associated with PAX6 gene mutation. You understand? So PAX6 gene mutation, remember these 3 very, very important: the aniridia, congenital aniridia, foveal hypoplasia, and nystagmus. So always make sure you'll have to look at the fundus for foveal hypoplasia. Okay. You may also have chorioretinal coloboma. That is because of the failure of fusion of the choroidal fissure. May have chorioretinal coloboma, may have. But lid coloboma not associated with this. Okay. Any other doubts related to today's image for those of you who joined late? So this is the image, and the image is there on my Instagram handle. It is EyeMentor, EYEMentor _Dr.Rajarathna, Rajarathna. Okay. Alright. So in this image, again, let's discuss before we wind up so that you get an idea again. it gets reinforced. So this is the caruncle. So this is the medial side of the eye. So this is the left eye, and you're seeing the aniridia. Yes, you see the aniridia, absence of the iris in the 6:30 to 7:30 position, clock hours. And this one is inferonasal in location. So this is a typical coloboma. Typical coloboma will always be inferonasal in location, and also this is the most common location of iris coloboma. So we describe this pupil as a keyhole pupil or a pear-shaped pupil. Yes, and besides that, you also see a cataractus lens and ectopia lentis. Now, why am I saying ectopia lentis? Because you are seeing the equator, the edge of the lens, equator of the lens, and an aphakic portion. So the lens has been displaced. So ectopia lentis as well. What are the components of Church syndrome? Yeah, I don't remember. Okay. Any other doubts regarding this particular image? So this image is important. Okay. Even without the cataractus lens, you might have just the iris coloboma. So remember the iris coloboma, very, very important, both in your OSCE, in your MBBS, and also for your NEET PG INI-CT. Okay. So any other questions regarding today's question? Okay. So follow me on my Instagram handle. Okay. EyeMentor Dr.Rajarathna. So you can see there, and your new tests. So I'm uploading free tests on the EyeMentor app. Please check them out. Okay, so the EyeMentor app you can download directly on the Google Android, and on your Apple you have to download My Institute app. Okay, it's got an orange graduation hat as a logo, and then you enter the ORG code OYQVB, right? And the free tests, so the free quiz will happen there for the next couple of days. Yes, yes, Bharat. One is aniridia, then you have foveal hyperplasia, number 3 nystagmus. Okay, so I will see you guys tomorrow at 9 p.m. Okay, so we'll discuss some questions, some image, and follow me on my Instagram handle. So whatever I post there, that we'll discuss at 9 p.m. here. Okay, see you. Bye. Good night. Any other questions? Okay, go through the video, guys. Good night.